Welcome to CareTree.me. CareTree is a collaboration platform designed to replace the paper records in the home health and senior care industries with an online platform that centralizes information and automates communication with care stakeholders.
This whole ability to communicate information as well as to give family members access to the record so that they can find some of the information themselves without having to ask questions and then me refeed them information would be so invaluable.
When we're in the loop, we can then manage that situation in the way that it needs to be managed, whether it's an urgent situation or whether it's something that we could contact the family when they're available and able to access that information. So having information about their condition and real time when they're in their own homes is absolutely critical.
CareTree allows users to create profiles based on their relationship with an individual. They can then invite other care stakeholders via email or through Facebook. In their CareTree profile, a user can select which information they want to receive about someone they are caring for and when they want to receive it, daily, weekly, or immediately. This ensures the right information is getting to them when they need it. In an individual's profile, it will show what comments are being made and by whom. This is the key dashboard for caretakers to see what is happening with an individual. This information will be searchable and categorized so management can easily find records for their quarterly government reports, or doctors can just see the medical actions happening. Users can create groups to easily share information to a specific audience. This could be the caregivers for a single individual, their family members, or their doctors. An administrator may also create a group with all of their caregivers so they can easily communicate with all of their employees at once. All the group communication is also accessible from a forum. This makes it easy to track what is going on in a conversation about an individual and the history of that conversation. CareTree replaces the paper files that caregivers use currently. Instead, this information can be entered in real time and shared automatically with the other care stakeholders so everyone is up to date and can provide the best care possible. This lowers caregiving costs and allows for better care to be provided. It also increases satisfaction of the families, who are often the key decision makers of deciding who their loved one will be cared for by. We are very excited to announce that we have been selected as a finalist for the inaugural AARP Health Innovation Live Pitch Contest at this year's National Convention. It will give us an opportunity to discuss CareTree with the VC market, but more importantly, we can get tremendous feedback from thousands of potential users. Hi, I'm Carl Hirschman, founder and president of CareTree.me. I also operate a company called Silver Fox Broadband. We provide internet, TV, phone, and IT solutions to the senior housing industry nationwide. This has really given me an opportunity to learn more about the senior care market, what's going on in it, and its current technology challenges.
Hi, my name is Vince Hoffmeister. I'm the CTO here at CareTree. I'm in charge of web development, mobile development, as well as API integrations.
Vince and Carl met while working on another web company that was winner of a national Bloomberg television contest, winner of Chicago Booth SeedCon social media contest, and finalist for Techstars New York City. CareTree was founded by Carl Hirschman to solve the problems his Silver Fox customers and others he was speaking to were facing in the senior care industry.
The process that we were going through was basically the utilization of emails, where I would send out an email and then they would respond individually with questions. I would find the answers to their questions, and then I responded to a reply all so that they would all see the question as well as the information that was being shared. But it was this back and forth of me being the keeper of data from various sources that I then had to resend to them. You know, the family calls me, I call the caregiver tells me something, I call the family back.
Right now what we're doing is our caregivers are required to contact us on the phone, and then they are told to follow up, and it can be a variety of ways. Either they come to the office and fill out an actual incident report, which can be inconvenient, or they're putting something in email format, so then we access it that way. Really, we're not getting the documented information in the time that we want it.
This opportunity is an $800 million market counting just existing home health and senior housing residents. It will be growing as the baby boomer market ages and begins needing care. There is actually an expected shortage of 2 million elderly care workers, and one of the only ways to fix this shortage is through more efficient care using technology such as CareTree. At first, we focused on communication between senior housing caregivers and families. We knew many assisted living communities were still on paper records and thought there had to be a better way. We started by interviewing as many senior housing caregivers as we could. We also got out and attended the Lincoln Healthcare Senior Housing Conference. We confirmed that most are communicating by phone and learned that although communities want to replace their paper records, many did not have the technology infrastructure to handle the change. Companies are also having a general problem with having to re-enter information into multiple platforms, from marketing to sales, billing, scheduling, admissions, and an EMR. They'd like a platform that centralizes and unifies the information. Learning from Belly.com, we thought iPads and smartphones may be a solution to the caretaker's IT infrastructure problem and began interviewing users to see if they were open to using these devices. As we interviewed more senior caretakers, we found a trend that skilled nursing communities were focusing most of their resources on their new EMR and might not be as open to implementing another software platform right now. However, home healthcare providers wanted to use this service as soon as possible. We learned that right now they keep a paper record in the home and all communication is directed through the central office. We confirmed that communities are open to using an iPad and learned that our price could cover the cost of the device and cellular data plans. We also attended a home health caretaker luncheon in Milwaukee and confirmed this with all the attendees. While the feedback was positive from all caretakers, we are now focusing on the home health market. This market displayed the greatest demand because records are kept on paper and communication is extremely inefficient. The need for a centralized platform that shares across all their other software is needed in all the care sectors, though. We are wrapping up programming of the MVP and have 3 home health trial clients eagerly awaiting testing. One of the key items we'll be measuring during the trial is the time it saves for making the phone calls. From our interviews, we found that it will be very important to show how we can keep a caretaker in the field, even if it's just 10 minutes more. In the future, we'll be exploring the meaningful use implications to hospitals and how insurers may benefit from CareTree through care communication efficiencies and ACOs. We validated the current focus through customer interviews and confirmed that caretakers were still using paper records and validated our later realization that we would need to provide some type of IT solution, such as an iPad, in order for them to access CareTree. Right now, we are specifically targeting non-medical home health agencies because they won't be relying on an EMR as their primary source of documentation. The size of the market is also validated by it being the largest category in the Franchise 500 list and growing. The decision maker is the owner of the franchise and shouldn't have multiple layers of saboteurs. We'll also target slightly larger, more established agencies. At this time, we won't be focusing on smaller franchises because they will be focusing on growing their business and may be the primary caretakers themselves. CareTree is a software as a service company. Our goal is to design it in a way where the sale and implementation is as uncomplicated as possible so we can distribute it directly online. The primary goals will be to drive traffic to the website where our customer acquisition cost yields a positive ROI. CareTree also has a viral effect because users will be encouraged to invite an individual's other care stakeholders, making them also aware of CareTree. In addition to web-generated interest, we'll use traditional marketing methods to build awareness. Through SilverFox, Carl has discovered what has the most positive effect in the industry and will leverage that to build awareness of CareTree at trade shows and in industry publications. We'll also be developing and leveraging partnerships. As we have success with individual franchise owners, we plan to leverage these relationships into showing the benefit of the franchise corporate office endorsing CareTree for use across their other franchises. Hospitals benefit because it helps them meet their patient portal meaningful use requirements. This may mean they'll pay for it themselves, or it could mean they encourage other caregivers to use it. This is the same for insurers because insurers benefit from the improved care that efficient communication provides. Thank you, and we look forward to seeing you as a user of CareTree.